warning signs your arteries may be blocked. Did you know that nearly half of first-time heart attacks happen without any prior warning symptoms? That means no chest pain, no dizziness, no shortness of breath, just sudden, life-altering impact. Cardiovascular disease remains the leading cause of death worldwide, and blocked arteries play a central role in that grim statistic. What makes it even more dangerous is that the early warning signs of clogged arteries are often subtle, easily dismissed as fatigue or just aging. And by the time more noticeable symptoms appear, the arteries can already be significantly narrowed, putting you at risk for a heart attack, stroke, or even sudden cardiac death. That's why it's so crucial to catch the early signs your body might be sending you before it's too late. Prevention isn't just better than a cure. It's cheaper, easier, and in this case, life-saving. Today, we're looking into 7 warning signs that your arteries may be blocked, backed by science, and explained in a way that helps you take real, meaningful action. Let's start with something that might surprise you: erectile dysfunction. It's a topic many people find uncomfortable to talk about, but erectile dysfunction, ED, might be one of the earliest warning signs that your heart health is in jeopardy. While most brush it off as a stress-related or psychological issue, the truth is far more critical. ED can be your body's subtle way of signaling that your arteries are starting to clog. This is because the blood vessels in the penis are significantly smaller than those supplying the heart, so when atherosclerosis, or plaque buildup, starts affecting blood flow, these smaller vessels are usually the first to show signs of trouble. Several major studies have confirmed this link. For instance, the Massachusetts Male Aging Study, MMES, one of the most comprehensive investigations on the subject, found that men with ED had a 45% increased risk of developing cardiovascular events compared to those without it. Another landmark paper, published in Circulation, followed more than 1,500 men and concluded that ED was a strong predictor of heart disease, even in men with no other symptoms. These aren't isolated findings either. A meta-analysis combining data from over 36,000 men found that those with erectile dysfunction had a 48% increased risk of cardiovascular disease, a 46% increased risk of stroke, and a 19% higher chance of dying early. So what's the biological explanation? It all comes down to the health of your endothelium, the inner lining of your blood vessels. In healthy arteries, the endothelium releases nitric oxide, NO, a molecule that tells blood vessels to relax and expand, allowing blood to flow freely. But in the early stages of atherosclerosis, oxidative stress damages this lining, reducing NO production. That makes it harder for vessels to dilate, especially in the penis, where the blood vessels are only 1 to 2 millimeters in diameter compared to the 3 to 4 millimeters arteries around the heart. That's why ED can often appear years before a heart attack or stroke. It's like a small leak in a pipe before the whole system bursts. If you're under 50 and experiencing ED, especially if it's persistent and not clearly linked to a psychological cause, it shouldn't be ignored. It could very well be a vascular issue, and more importantly, a red flag for what's happening in your coronary arteries. This isn't about scaring anyone. It's about catching a potentially fatal condition early, when it's still reversible through lifestyle changes, medical treatment, and prevention. Another sign that's often brushed off is persistent fatigue, especially during physical activity. We all get tired now and then, after a long day, a poor night's sleep, or skipping a meal. But if you find yourself feeling unusually exhausted after doing something as simple as walking up a flight of stairs or carrying in the groceries, it could be more than just fatigue. It could be your heart waving a red flag. When your arteries are blocked or significantly narrowed, they can't deliver enough oxygen-rich blood to the muscles and organs that need it during activity. This results in a kind of low-energy state where your body forces you to slow down, not because you're lazy or out of shape, but because it's protecting itself from overworking the heart. This kind of fatigue is different. It's not the kind you recover from with a quick nap or a good night's sleep. It feels more like your body running on empty even after minimal effort. From a physiological perspective, what's happening is known as reduced perfusion. Essentially, Perfusion is the process by which oxygenated blood is delivered to the tissues. When arteries are narrowed by plaque, a condition known as atherosclerosis, the heart has to work harder to push blood through. The muscles don't get enough oxygen, so they tire quickly. Imagine trying to water your lawn with a hose that's pinched. Some water still comes through, but not enough to cover the area effectively. That's exactly how your blood vessels behave when they're blocked. Research supports this. A study from the Cleveland Clinic showed that patients with coronary artery disease often report fatigue as one of the first noticeable symptoms, even before chest pain. Another review of over 7,000 patients found that unexplained fatigue during mild exertion was strongly correlated with ischemic heart disease, especially in women. Interestingly, in many female patients, fatigue appears more frequently than the classic symptom of chest pain, making it a particularly important warning sign in women over 40. What's dangerous about this type of fatigue is how easily it's brushed off. People assume they're getting older, not eating right, or just out of shape. But when ordinary tasks begin to feel unusually taxing, it's time to take a closer look. If your energy levels have noticeably dipped and the fatigue doesn't match the level of activity, your arteries could be silently struggling, and your heart might be paying the price. Now here's one that often flies under the radar: leg pain when walking, also known as claudication. If your legs start cramping, aching, or feeling unusually heavy after walking just a short distance, but the pain eases when you rest, that's not something to ignore. This is one of the most telling signs of peripheral artery disease, or PAD, a condition that's essentially atherosclerosis targeting the arteries in your limbs, particularly your legs. What's happening inside your body is quite serious. As you walk, your leg muscles demand more oxygen. But if the arteries are narrowed or partially blocked by plaque, that oxygen can't get through efficiently. The result? Your muscles start to hurt, not unlike the way your chest would hurt during a heart attack due to blocked coronary arteries. Think of it this way. Your legs are asking for fuel, but the delivery lines are kinked. That demand-supply mismatch causes pain known as claudication, which is PAD's most recognizable symptom. The pain usually crops up during physical activity and disappears with rest because the muscle's oxygen demand goes back down. But here's the real kicker. PAD isn't just a leg problem. It's a sign that your entire vascular system could be compromised. When arteries in one area are clogged, it's rarely an isolated issue. In fact, studies have found that over 50% of people with PAD also have significant coronary artery disease. In other words, your aching legs might be telling you what's happening in your heart. A large-scale study called the Partners Program revealed that PAD affects roughly 1 in 20 people over age 50. That number jumps dramatically with age or if other risk factors like smoking, diabetes, or high cholesterol are present. What's especially dangerous is that PAD often goes undiagnosed because people attribute the pain to aging, arthritis, or lack of fitness. Yet PAD carries a chilling statistic. Individuals with this condition are 3 to 6 times more likely to die from cardiovascular causes. And here's something even more alarming. PAD can progress silently. By the time you feel symptoms, your arteries could already be significantly narrowed. This is why early detection and intervention are crucial. If walking a few blocks has become more difficult, or your legs feel chronically tired or painful after modest exertion, don't just chalk it up to getting older. It could be a warning sign from your arteries, letting you know they're struggling to keep up, and so is your heart. Let's talk about shortness of breath. Ever find yourself out of breath after doing something that used to feel effortless, like climbing a flight of stairs or taking a brisk walk around the block? It's tempting to blame it on being out of shape or just getting older, but persistent shortness of breath during light activity can be a serious red flag, one that points straight to your heart. This isn't just about low stamina. It's often one of the earliest and most overlooked symptoms of coronary artery disease, CAD, where plaque builds up in the arteries and restricts blood flow to the heart muscle. Here's what's happening behind the scenes. When your coronary arteries are narrowed, your heart struggles to get the oxygen-rich blood it needs, especially during times of increased physical demand. So, even moderate exertion causes your heart to work harder, and when it can't keep up, your breathing rate increases to compensate. The scientific term for this is impaired cardiac output. Essentially, the heart's reduced ability to pump sufficient blood with each beat. At the same time, oxygen delivery to your lungs and muscles becomes inefficient, making you feel breathless much faster than normal. Interestingly, studies have shown that dyspnea, meaning difficulty or labored breathing, is often reported even before chest pain in individuals developing CAD. In fact, research from the Framingham Heart Study and other large-scale cardiovascular trials found that unexplained breathlessness was a significant predictor of future cardiac events, even among those with no previous history of heart problems. And this symptom doesn't just affect people with advanced heart disease. Many younger adults, especially those with risk factors like high blood pressure, diabetes, or smoking history, have reported exertional breathlessness as their first sign of vascular trouble. What makes this so dangerous is how easy it is to dismiss. You might think you're just a little out of shape or tired. But if climbing stairs or carrying a bag of groceries suddenly leaves you winded, that's your cardiovascular system struggling in real time. And often, this struggle is silent. There's no sharp pain, no dramatic episode, just a quiet but persistent signal that something isn't right. Speaking of chest pain, let's not ignore angina. When you think of a heart problem, what's the first image that comes to mind? Probably someone clutching their chest in pain, right? While that's not entirely wrong, it's also not the full picture. Chest discomfort, known medically as angina, is perhaps the most recognized sign of blocked arteries, yet it's also one of the most misunderstood. People expect angina to be sudden, sharp, and dramatic, like something out of a movie. But in reality, it's often much more subtle and deceptively quiet. Angina can feel like pressure, tightness, squeezing, heaviness, or even a burning sensation in the chest. And here's the tricky part. It doesn't always stay in the chest. It can radiate to the shoulders, arms, neck, jaw, or even the back. Some people mistake it for heartburn or a pulled muscle. It tends to happen when you're physically active or emotionally stressed, moments when your heart needs more oxygen than usual. The discomfort typically eases when you rest, which is a key clue that the problem is related to blood flow. The root of this issue is ischemia. That's when part of your heart muscle isn't getting enough oxygen because the arteries supplying it are narrowed or partially blocked by plaque buildup. During rest, the reduced flow might be enough to get by. But during exercise or stress, your heart's demand increases, and the narrowed arteries can't deliver what's needed. That's when the symptoms show up. Think of it like a traffic jam in your arteries. The destination, your heart muscle, is right there, but the oxygen supply is getting stuck in congestion. Studies have consistently shown that angina is a major predictor of coronary artery disease and future cardiac events. In fact, up to 9 million adults in the U.S. alone report symptoms consistent with angina, yet many go undiagnosed because the symptoms don't match the classic chest-grabbing stereotype. What's even more concerning is that people often downplay these signs, attributing them to indigestion, stress, or just getting older. But if you've ever felt chest pressure or tightness after climbing stairs, walking briskly, or facing a stressful moment, and it disappears when you sit down, that's not something to ignore. It could be your heart sending a warning before something more serious occurs. This isn't about living in fear. It's about living with awareness. One symptom that many overlook, especially women, is upper back or jaw pain. It might surprise you to hear that pain in your jaw, neck, or upper back could actually be your heart crying out for help. While it doesn't seem like a logical connection at first, science tells a very different story, especially when it comes to women. Studies have shown that atypical or non-classic symptoms of cardiac ischemia are significantly more common in women than men. That means pain showing up in areas like the jaw, shoulders, upper back, or even the arms, particularly when it's unexplained and comes on during physical activity, can be a subtle but serious warning sign of blocked arteries. So why does this happen? It has to do with the way nerves in the body communicate. The nerves that serve the heart share pathways with those in the upper body. This is known as referred pain. When the heart is deprived of oxygen due to restricted blood flow, a condition called ischemia, it sometimes doesn't send pain signals directly from the chest. Instead, the discomfort radiates outward, making it feel like something's wrong in your neck, your back, or even your teeth and jaw. And because these areas don't scream heart problem, to most people, they often get overlooked. Research, including large cardiovascular studies focused on sex differences, has found that women are more likely than men to experience these unusual symptoms, particularly during exertion or emotional stress. What makes it even more concerning is that women also tend to be diagnosed later in the course of heart disease. That delay in recognition and treatment can be deadly. According to the American Heart Association, women under the age of 55 who present with atypical symptoms are more likely to be misdiagnosed in emergency settings compared to men, contributing to higher mortality rates in younger women with heart disease. That's why recognizing this early and seemingly unrelated pain is so important. If you ever notice persistent discomfort in your upper body, especially if it comes on during exertion or emotional stress and settles down with rest, don't brush it off. It could be your heart sending signals through less obvious routes. And if you're a woman, this is even more critical to pay attention to. You don't need chest pain to be having a heart issue. Sometimes, the body speaks in whispers before it screams. Listening to those whispers might just save your life. And finally, let's talk about high blood pressure, or more accurately, resistant high blood pressure. If your blood pressure refuses to come down, even with multiple medications and healthy lifestyle changes, it might be time to look beyond just bad genes or stress. One often overlooked cause is something much more structural: stiff or clogged arteries. When your arteries are healthy, they're flexible and elastic, allowing blood to flow freely with each heartbeat. But when plaque starts to build up inside them, a condition known as atherosclerosis, they lose that flexibility. This makes it harder for the blood to move through, and as a result, your heart has to work extra hard to push it forward. That extra effort translates into elevated blood pressure. Here's the mechanism. As arteries narrow and harden, systemic vascular resistance increases. This means your heart is pushing against more force than it should, leading to a consistent rise in blood pressure. And high blood pressure, or hypertension, isn't just a number, it's a powerful force that damages the artery walls even further. The more damage there is, the more likely plaque will accumulate, creating a vicious cycle that's hard to break. What starts as mild hypertension can evolve into something far more dangerous, increasing the risk for heart attacks, strokes, and kidney disease. This is especially concerning in a condition called resistant hypertension, which is defined as high blood pressure that remains uncontrolled despite using at least 3 different types of blood pressure medications, including a diuretic. Research shows that people with resistant hypertension have a significantly higher chance of having undiagnosed vascular problems like renal artery stenosis or widespread atherosclerosis. In many cases, advanced imaging tests like a coronary calcium scan or arterial Doppler studies reveal plaque buildup that simple blood pressure checks alone can't detect. So if your numbers remain stubbornly high, despite all the right efforts, it's worth considering that the real issue might be hidden in your arteries. Don't settle for just genetics as an answer. Your body could be telling you there's a deeper, vascular problem brewing beneath the surface, and the earlier you investigate, the better your chances of turning it around. So, who's most at risk and should pay the most attention? Anyone over 40, especially those with a family history of heart disease, smokers, people with diabetes, and those who are overweight or sedentary. But even if you're young and relatively healthy, don't dismiss these signs. Heart disease doesn't always wait until your golden years to strike. Increasingly, we're seeing heart attacks in people in their 30s and 40s, and the numbers are rising. So there you have it, 7 early signs your arteries may be blocked, explained in a way that puts you back in control. No scare tactics, no miracle cures, just real talk backed by science and practical ways to act before it's too late. And the earlier you act, the better your chances of preventing something serious. Don't wait for the sirens and the ER visit. Listen to your body now. It might just be trying to save your life.